Hi, I'm Dr. Ronny Tan. I'm a consultant urologist from Mount Elizabeth Hospital. My subspecialty is in the field of andrology, men's health, and urological prosthetic surgery. So kidney stones are basically crystals that actually enlarge in size in the urine. So they are solid particles that actually form in the kidney, and sometimes these stones can get infected, or the stones can increase in size, causing blockage in the flow of the urine, either from the kidney all the way down from the ureter, even up to the bladder. Most commonly is due to diet, where the patient takes excessive salt in the diet or high sodium diet. The other group of patients that are more prone to forming stones will be those patients who don't drink enough water, inadequate hydration. Of course, there are also patients with underlying medical issues like endocrine problems or some problems in terms of excretion of the calcium. These patients also are more prone to forming stones. The most common symptom from a kidney stone will be what I call colic, which is pain. Patient usually presents with back pain, so it's on and off, but it's one of the worst pains that is known to men. So when a patient comes to us, we will do an examination to check whether there's any signs of infection due to the stone and how sick the patient is. We do an ultrasound. The ultrasound will give us an idea where the stone is and whether the stone is causing any problems. Will be combined with a urine test to look for infection. In cases where the patient is not doing so well, we might even need to do blood investigations. So other than ultrasound, we also do procedures like x-rays, and in some patients even a CT scan. So when the patient presents to us with renal colic or pain from the stones, we usually start some painkillers that tide them through. If there's signs of infection, we even add on antibiotics. Any stones that is less than 5 millimeters in diameter, there is an 80% chance over 40 days that the stone will pass by itself. For the treatment of stones, we have shockwave treatment versus surgery. So shockwave therapy is treatment where we actually localize the stone, either using fluoroscopy or x-rays. Then we actually focus this treatment head and deliver targeted waves to fragment the stone. So these stones will be fragmented and the patient will still have to pass the stones out on their own. We used to have to do open surgery to remove stones, but with improvement in terms of medical technology, there are two ways. One way is what we call retrograde intrarenal surgery, where we actually insert a scope from the urethra into the bladder, up the ureter, which is the urine tube that connects the bladder to the kidney, all the way out to the kidney. Under direct visualization, we use a small laser fiber, break the stones into fragments, and then we actually pull out the stones for the patient. In those cases, a patient will be put up for PCNL, what I call percutaneous nephrolithotripsy. In summary, basically what we do is we actually puncture the kidney through the back, and then using a scope, we'll go from the top instead to remove the stone using different energy sources. So treatment of stones will depend on the size of the stone as well as the location of the stones. So most urologists will say that for stones above the size of 2 centimeters, PCNL will actually be a good option. However, if there are patients who are not suitable for PCNL due to medical conditions, repeated RARS is the other way to go.